Hello everyone. Today's class is about respiratory acidosis and alkalosis and metabolic acidosis and alkalosis. So first let's get into the basics about the buffer system in our blood. What is the buffer system in our body known as? It is the bicarbonate buffer. So how does it work? In this, the carbon dioxide combines with water in the presence of carbonic anhydrase to produce H2CO3, which then dissociates to form HCO3 minus plus H plus. So as you all can see, this is an equilibrium reaction. So this reaction can proceed in either direction. So why is there a need for a buffer in our body? So basically, what is a buffer? A buffer is a solution that resists change in pH when acids or bases are added to it. That is, the normal pH of our body should always lie between 7.35 to 7.45 to maintain the normal homeostatic mechanism of our body. Only then it can function properly. So if there is any external factor that interferes with this pH of our body, then this buffer system will act and proceed the reaction in either direction to attain the normal pH. So first, let's move to respiratory acidosis. So in respiratory acidosis, what happens is initially the patient has an underlying cause which causes an increase in the CO2. So in which patients do we see an increase in CO2? That is a patient who is having asthma, or a patient of COPD, or a post-op patient, or a morphine toxicity patient. In all these patients, they have CO2 retention, which could cause an increase in the CO2. So now there is an increase in the carbon dioxide concentration. So what will be the compensatory mechanism? That will be to drive the reaction towards right hand side so as to decrease this increased CO2. So now the reaction will proceed towards the right hand side, and eventually which will lead to an increase in the hydrogen ion concentration. So what is pH? pH is inverse of the hydrogen ion concentration. So as pH increases, as hydrogen ion concentration increases, the pH would decrease. So in respiratory acidosis, the CO2 will increase and the pH will decrease. Now in respiratory alkalosis. In respiratory alkalosis, what happens? There is a decrease in CO2. What would be the underlying cause in a patient of anxiety or panic attack? The patient would be hyperventilating, which could cause a CO2 washout and then a decrease in CO2. Now, as a result, what will happen in the respiratory system? The reaction will start moving towards the left-hand side so as to increase the decreased CO2. And then as a result of this, the hydrogen ion concentration will reduce. Because why? The hydrogen ion combines with HCO3 minus to produce H2CO3, which can dissociate to form CO2 and H2O. So as to increase this CO2, this H plus ion would eventually decrease, and that would cause an increase in pH. So in respiratory alkalosis, since it's an alkalosis, the pH would be high, and as you all can see, the CO2 would be reduced. Now, before I describe this part of it, let me explain to you about the concept of metabolic acidosis and alkalosis. Now, in metabolic cases, we are concerned with this part, that is, the driving force would start from the right hand side. So what happens in metabolic acidosis? In metabolic acidosis, then as the name suggests, there could be an increase in the H plus ion concentration, or there could be a decrease in the bicarbonate ion concentration. So in which cases do we see this? In a case of ketoacidosis, that is diabetic ketoacidosis, or in cases of aspirin toxicity, because aspirin chemically is acidic, or in a patient with any renal abnormality, or any other causes. You can look up for the causes. In these patients, so primarily there would be a increase in the H plus or decrease in HCO3 minus, and as a result, now the body tries to compensate. So what happens? The respiratory system will try to compensate for this increase in H plus. So there is an increase in H plus. So now the respiratory system will try to create an image of alkalosis. So in order for respiratory alkalosis to happen, the CO2 ion should be decreased. Only then will the H plus and HCO3 minus will combine to produce increased CO2. So in this process, the H plus would get consumed. So the body as a compensatory mechanism will hyperventilate and cause a decreased CO2 level. So Then that way the H plus ion and bicarbonate ion would combine to produce an increase in the CO2, and in this way the increased H plus ion will get compensated. So what happens in metabolic acidosis, the respiratory system compensates by creating an image of respiratory alkalosis. In that way the increased H plus would get consumed. Now in metabolic alkalosis, what would be the underlying cause? It could be either because of an increase in the bicarbonate ion or a decrease in the H plus ion. Now in which cases do we see this? In a patient with excessive vomiting, because then along with the vomitus they vomit the HCl out of the stomach, so there could be decreased H plus, or in cases of antacid consumption, or in cases of any other kidney diseases, there would be a picture of metabolic alkalosis. So here again, when there is alkalosis, the body tries to compensate, that is the respiratory system would compensate. So the respiratory system now will try to create an image of acidosis, because now the body is in alkalosis. Now the respiratory system will try to compensate by producing hypoventilation, because when hypoventilation happens, CO2 level will increase. So when CO2 level increases, the reaction will start proceeding towards the right hand side so as to increase the concentration of H plus. So in this way we can compensate for our metabolic alkalosis by creating an image of respiratory acidosis. So in an easier way to remember, if we get an ABG report, is how do we understand if it is a respiratory acidosis alkalosis or a metabolic acidosis alkalosis? So what do you look for first? First you look into the pH. Now if the pH is reduced, there can be two causes. It can be a respiratory acidosis or a metabolic acidosis. Now how to remember easily? If the pH and the CO2 are in opposite direction, then it's a respiratory cause. So pH here is reduced and CO2 is increased, then it is a respiratory acidosis. If both pH and CO2 are reduced, then it's a metabolic acidosis. Same way, if pH is increased, then it is an alkalosis. Now how do we understand if it is respiratory or metabolic? We look into the CO2. So if they are in the opposite direction, then it is a respiratory alkalosis. If they're in the same direction, then it is a metabolic alkalosis. So I hope this was simplified for you all. You can watch the video again in case the concepts are not clear. Thank you.